Welcome. I'm Eric D'Amata, and today I will be joined by Angela Chang, Nana Darugana, Kate French, Parisa Majidi, Juliana Ordonez, and Ruwan Wickramasinghe to discuss the population health model with a specific focus on Singapore. Singapore's healthcare model is one of the most efficient models in the world, with healthcare expenditures at roughly 4% of GDP compared to 16% in the US. Even with this low per capita spending, the system maintains similar outcomes to other developed nations. Singapore achieves these results through a universal healthcare system that takes steps to curb unnecessary spending and invest in population health initiatives, thus limiting downstream expenditures through preventive measures. Singapore's healthcare system is comprised of a trifecta of government regulators, predominantly public funding sources, and a mixed delivery system. The Ministry of Health is the governing body of the healthcare system. They promote health education, license and regulate healthcare establishments, promote access and well-being, prevent the spread of illness, and allocate resources, including human capital, to ensure the system is operating efficiently. The Central Provident Fund oversees Singapore's compulsory savings plans, which includes the MediSave account. The monetary authority of Singapore is the central bank, and as such is responsible for regulating third-party insurance firms that operate in the country. These companies offer health insurance in addition to Singapore's 3M system. Singapore's healthcare system delivery is based on Western medical science. However, they are currently evaluating standards of practice for traditional Chinese medicine to better address the alternative medicine desires of some ethnic groups within the population. In terms of general healthcare delivery, the system operates with a mixture of private and public providers. Primary care is largely delivered by private clinicians, while hospital care is largely government-run. Singapore provides dental care at the National Dental Centre Singapore and the National University Centre for Oral Health Singapore. Long-term care and support services are also available with both public and private options. Singapore is a universal coverage system and is highly focused on personal fiscal responsibility and ensuring agency is given to the individual. This serves to reduce costs and overutilization. The coverage is mostly administered through the E3M, consisting of MediSave, MediShield, and MediFund. Individuals pay into MediSave on a regular basis through their employer or directly if self-employed. MediShield is an opt-in catastrophic insurance that carries its own premium. MediFund is a government-funded safety net insurance for instances where individuals are unable to pay for their care. ElderShield acts as a severe disability insurance at affordable rates and is being replaced by CareShield Life as of 2020. The history of Singapore's healthcare system starts prior to the founding of the country in 1965. Up until that point, the country's healthcare system was modeled on the Beveridge model in Great Britain. Several of the major hospitals in the country today were first built by the British military, including Alexandria Hospital. Once Singapore gained their independence, they spent the next 20 years largely focused on the economy. As a small nation with negligible natural resources, becoming an economic powerhouse was no small feat, but they succeeded in their efforts and today are the sixth largest in the world in GDP per capita. During the period of lesser healthcare focus between 1965 and 1980, healthcare initiatives were largely focused on public service campaigns. Throughout the years, they launched several campaigns, including ones focused on family planning, dental health, heart health, and smoking. Some of these were relatively successful, particularly the family planning one, which helped reduce fertility rates from over 4 to less than 2. During this period, many hospitals were established, both public and private. In 1983, Singapore introduced their first national health plan. It laid the foundation for a system designed on prevention and launched MediSave to fund it in 1984. The health system rapidly evolved from there, with MediShield launching in 1990, MediFund in 1993, MediShield Plus in 1994, ElderShield in 2002, and MediFund Silver in 2007. ElderShield is now being replaced by CareShield Life. In 2012, Singapore announced their Healthcare 2020 Master Plan, which included new initiatives to ensure healthy living is at the doorstep of every home, workplace, and school. There was a focus on the 3 Ps of place, people, and price to achieve their goals. Now that the 2020 plan has been completed, Singapore is embarking on Healthier SG, which aims to improve primary care in an aging society that is seeing an increase in chronic diseases. I will now hand it over to Angela, who will speak more on the Republic of Singapore.
All right, thank you, Eric. Now, before we really dive into Singapore's healthcare industry, let's take a look at the country as a whole. The formal name of Singapore is Republic of Singapore, located in Asia between Malaysia and Indonesia. It is about 3.5 times the size of Washington, D.C., a government style being a parliamentary republic. It has a very high literacy rate amongst the world, with a total population of 97.5% being able to read and write, and one of the lowest fertility rates in the world. Among other languages, the primary language that Singaporeans speak is actually English and Mandarin. And here is the pestle analysis of Singapore. So to begin with, politically, we mentioned earlier that it has a parliamentary republic. An interesting fact is that actually their citizenship is not granted at birth. At least one of the parents must be a citizen of Singapore to be granted a Singaporean citizenship. It actually has very low political risk. Moving on to economic, it is a high income, wealthy nation that is renowned for its advantage in the financial markets and among the Asian infrastructure exchange. The government's diversified economy to include tourism and to be highly active in the pharmaceutical industry as well. Next is sociological. So the people of Singapore are called Singaporeans, and again, they have a very high literacy rate, and overall, they follow the traditional family values. For technology, over 90% of the population are internet users, so you can assume that technology is highly visible in a lot of households, and e-commerce therefore has flourished because of the wide vast of access to technology. And in terms of legal, because with the rise of e-commerce and technology, there has been a lot of introduction of laws and policies among e-commerce. And lastly, for environmental, one of the priorities for Singapore is to maintain a better air quality, as there are a lot of pollution from transportation. In addition, their other top priority for environmental is a lack of water resources, as the country is primarily dependent on the Malaysian water supply. And for this slide, we'll talk about the primary health issues which caused one of the leading deaths in Singapore in 2022. So top three are listed here. The first one being cancer of about 24%. Second with pneumonia coming at 20%. And then third being ischemic heart disease coming at about 20% of the deaths in Singapore, leading to death because of these three top diseases. And with that, I'll hand it over to Nana so she can discuss the healthcare structure of Singapore.
Thank you, Angela. Now let's talk about the health system structure of Singapore. The Ministry of Health and its statutory boards are responsible for regulating Singapore's healthcare system, serving as the key entity that governs the health system in Singapore. Its purported mission is threefold: to promote good health and reduce illness, ensure access to good and affordable healthcare, and pursue medical excellence. The mission of the Ministry of Health is carried out by its three primary divisions. The first, the Policy and Corporate Group, which licenses and regulates all healthcare establishments, including hospitals, nursing homes, clinics, laboratories, and healthcare professionals. The second, operational groups, which manage specific healthcare programs such as the Healthier Singapore Initiative, which promotes preventative care and healthy living. And third, the professional groups, which oversee healthcare professionals such as doctors, nurses, dentists, pharmacists, and allied health professionals. Let's go further into the different parts working with and under the Ministry of Health. The Ministry of Health oversees several statutory boards that play their part in upholding the standards and regulations in Singapore. The boards operate autonomously and are the Health Promotion Board, which, as its title suggests, focuses on promoting healthy living and preventing diseases, and the Health Sciences Authority, which regulates health products, medical devices, and drugs, ensuring their quality, efficacy, and safety. The Ministry of Health has established several professional boards that function under the Secretariat of Healthcare Professional Boards, and like the statutory boards, operate autonomously, but in this case they regulate specific healthcare professions. These boards are the Singapore Medical Council, the Singapore Dental Council, the Singapore Nursing Board, the Pharmacy Council, the Optometrists and Opticians Board, Specialist Accreditation Boards, which includes family physicians, dental, and other specialties, the Singapore Dental Council, Allied Health Professional Council. This one regulates allied health professionals, like physiotherapists, occupational therapists, and radiographers, and the traditional Chinese medicine practitioner boards. The major function of these professional boards is to establish entry requirements for their professions, set practice and ethical standards for their professions, ensure competency, and lastly, to investigate complaints and take necessary disciplinary actions. While the Ministry of Health Holdings isn't directly involved with treating patients or healthcare regulation, it does act as a central governing body for Singapore's public healthcare institutions, like the National Healthcare Group and Singapore Health Services. The MOHH focuses on resource allocation across these institutions and plans for future needs. In the words of the MOHH itself, it is the holdings company for Singapore's public healthcare institutions, overseeing effective and efficient distribution of resources to deliver value-based healthcare. The MOHH is the holding company of Singapore's public healthcare clusters, the National University Health System, National Healthcare Group, Singapore Health Services, and the Agency for Integrated Care. Each cluster is responsible for a specific geographical region and provides a range of healthcare services. These services include hospital care, polyclinic care, and preventative care. The National University Health System cluster manages hospitals and other healthcare facilities in the western region of Singapore. The National Healthcare Group does this in the central region, and the Singapore Health Services takes care of the eastern region. While the three regional clusters provide hospital care and polyclinic care services, the Agency for Integrated Care, or the AIC, provides resources, funding, and training to community care providers and for community care centers in Singapore. They do this for the elderly population as well as other patients through public education and care navigation. Singapore operates as a unitary state, which means it's not a federal system like the United States. The national government, through the Ministry of Health, holds the primary responsibility for healthcare and sets the overall healthcare policy framework in Singapore. Singapore has a two-tiered healthcare coverage system, which Kate will go more in depth on later. Medisave is a compulsory savings scheme that is managed by the Central Provident Fund and acts as a mandatory savings account for medical expenses. It helps cover basic medical bills at public hospitals and some private clinics. The second is MediShield. This is a compulsory health insurance scheme that provides catastrophic healthcare insurance for those that cannot afford the larger medical expenses. There is a third supplementary tier called the MediFund. This is for those that still have financial difficulties paying for medical expenses, even with the assistance from Medisave and MediShield. This one is managed by the Ministry of Health. Singapore's health system is a blend of social justice and market justice. It is a hybrid model with elements of market justice and its strong private sector. Singapore offers a network of private hospitals and clinics, giving people a choice in their healthcare decisions. There's also a component of individual responsibility for citizens to contribute to the mandatory health savings account for basic medical costs. On the social justice front, Singapore has universal health care, with the government subsidizing healthcare costs for low-income citizens via the MediFund program. In addition, for those that cannot afford private health care, there's a network of public hospitals and clinics as well.
Thanks, Nana. I'll talk more about Singapore's coverage. Singaporeans pay into a compulsory fund called the Central Provident Fund, or CPF. And this fund focuses on meeting three basic needs. 1, buying a house. 2, having insurance and savings for your healthcare. And 3, having a steady stream of retirement income. CPF account contributions, which are paid as a portion of your income, depend on your age. Someone below the age of 55 is going to contribute 20% of their wages to their CPF. Their employer is going to contribute 17% of their wages. giving a total of 37%. As the citizen ages, they contribute less and less, as does their employer. The allocations of the CPF vary based on age as well. When you're your youngest, you're contributing the most to your ordinary account, likely because you want to buy a house. But as you get older, your contributions change and focus more on MediSave, which is the point of this class. MediSave will pay for your MediShield premium, 75 to 80% of your medical costs, and optional additional coverage. Why only 75 to 80%? Well, this is because when the Singaporean government was established, they had viewed the British healthcare system as flawed. They felt it was inappropriate that citizens did not have any personal responsibility with relation to their healthcare costs. And so they limited it so that residents would have skin in the game. MediSave and MediShield Life are compulsory aspects of Singaporean life, but there's also the option to get an integrated shield plan, which covers MediShield Life premium, but also offers additional coverage. As you can see, 68% of the population invest in additional care beyond MediShield Life. The integrated shield plan gets its name because it integrates with MediShield. So it covers your MediShield premium, and then it adds additional coverage for private care, for nicer care, for quicker care, for making sure that you don't have to pay out of pocket, etc. The MediShield Life and the Integrated Shield Plan are paid by your MediSave account. However, MediSave is subject to withdrawal limits depending on age, and they're shown at the bottom of the screen. This slide has a lot of content on it, so let me sum it up for you very briefly. MediSave can be used to cover a lot of your healthcare costs. It's comprehensive in the sense that you can use it to cover hospitalization, surgery, palliative care, outpatient, inpatient, health screenings, vaccinations, having a baby, all of it. However, it's subject to withdrawal limits. As I mentioned previously, it's like 75 to 80%, but if you want more detail, you can see the various withdrawal limits for each aspect of care. For example, day surgeries, you can get up to $300 per day. Renal dialysis, $450 per month. These are just a couple examples. All of this boils down to a distribution of healthcare spending as shown. The majority is government transfers, which includes MediSave and the subsidies. The second highest, 23%, would be out of pocket. Here are your key coverage takeaways. Most permanent residents have a mixture of public and private insurance. They make compulsory contributions to the CPF, mandated based on a percentage of their income respective to their age. Healthcare is then paid for through a mixture of these compulsory savings and personal responsibility. Those with very low income receive additional support from the government. I'm now going to hand it off to Parisa, who will talk more about health system performance.
Thank you, Kate. Let's explore the health system in Singapore, renowned for its efficiency and effectiveness. Singapore's health system anchored by three main components: MediShield Life, MediSave, and MediFound. MediShield is a mandatory health insurance plan covering all Singaporeans with large hospital bills and selected costly outpatient treatments. MediSave is a compulsory saving program that helps individuals set aside part of their income for future medical expenses. Lastly, MediFound acts as a safety net for those who cannot afford their healthcare expenses despite subsidies and MediSave. This integrated approach ensures every citizen has access to necessary medical services, enhancing the overall system performance and healthcare outcomes. Moving on to our next slide, we delve into the critical components of Singapore's health system: cost, quality, access, and equity. Spending only 6.05% of its GDP on health as of 2020. Singapore manages to maintain high-quality care through stringent regulations and monitoring by the Ministry of Health. The accessibility is universal via MediShield Life, an example of how the system balances cost with quality to ensure equitable access for all citizens. regardless of income level. As we compare Singapore with OECD countries, we notice it spends a lower percentage of GDP on healthcare, yet achieves impressive outcomes. The government's proactive approach in 2021, increasing health spending to 5.8%, reflects its commitment to enhancing citizens' longevity and health access. This includes comprehensive coverage from Medishield Life and subsidies for lower to middle income groups through the Community Health Assistance Scheme. Finally, let's look at the strategies and market activities influencing Singapore healthcare system. The government uses varied subsidies and strict cost controls, including the Medishield Life program, to manage healthcare expenses effectively. The Ministry of Health ensures high quality by closely overseeing operations and following clinical guidelines. Programs like MediFound and Pioneer Generation Package are essential for reducing health disparities. Additionally, the shift from hospital-based care to ambulatory settings mark a significant move toward more efficient and sustainable healthcare delivery. I will now hand it over to Juliana, who will delve deeper into the detail of MediSafe.
Thank you, Parisa. So now we're going to talk about the innovations or areas of excellence in the system. Singapore ranks 10th in the 2022 World Index of Healthcare Innovation. The country's high scores for choice and its strong research universities, as well as its top-notch digital healthcare, contributed to its overall performance. Despite being a leader in medical innovation with an impressive number of healthcare patents, Singapore's fiscal performance is a concern, ranking 16th for fiscal sustainability. The Ministry of Health has launched the Industry Transformation Map 2025 for healthcare, aiming to transform population health through innovative and sustainable strategies. Singapore's healthcare initiatives. Singapore hosts its own e-health service development program, HSDP, which was established by the Health Ministry with the specific objective of developing new health services and medical capabilities. It does so by funding three types of pilot projects. The first one, cutting-edge medical technology that has yet to be evaluated in the market. The second one, well-established advanced treatments which due to cost are offered on subsidized basis only to those patients who are most likely to benefit from them. And the third one, significant improvements in current management capability for certain diseases. National Electronic Health Record NEHR system was implemented in 2011. The NEHR system is used by all primary, secondary, and tertiary care facilities. Billing and supply chain management is electronic as laboratory, pathology, pharmacology, and radiology information. The NEHR enables healthcare providers to access patient medical records, facilitating better care coordination and decision-making. What we found interesting is that Singapore does not have an automated vaccine alert system, but it does have electronic medical appointment reminders, mobile telehealth, and a national policy regarding the use of social media to promote public health. Singapore is one of the few countries in the world, actually the 5%, that can claim to have a strategy for using social media. This impacts the quality of the system. To keep with its diverse culture, the Singapore publicly funds and e-health services are provided in multiple languages. Singapore views technology as an indispensable addition to the provision of an optimal healthcare. Telemedicine and digital healthcare initiatives is that Singapore has encouraged the adoption of telemedicine and digital health solutions, expanding access to healthcare services, particularly for rural and elderly populations. This enhance access and equity for the system. Agent in place initiatives. Singapore has introduced programs to support elderly citizens, enable them to age in their homes and communities, reducing healthcare costs and improving quality of life. And the National Diabetes Prevention Programs (NDPP) was launched in 2019. These programs aim to reduce the incidence of diabetes through early intervention and lifestyle modification. Singapore's healthcare innovation and reforms. In 2017, Singapore's Ministry of Health unveiled its Beyond Healthcare 2020 strategy, aimed at shifting care to the community, promoting health and ensuring value. The following year, the ministry introduced the Licensing, Experimentation and Adaptation Program, a regulatory sandbox designed to foster innovation in healthcare through industry partnerships. This program explores new healthcare solutions like telemedicine and mobile medicine, while prioritizing patient safety and welfare. To enhance protection against long-term care costs, the ministry launched CareShield Life in 2020, replacing ElderShield. This new scheme offers higher cash payouts starting at about $438 and increasing over time with no cap on payouts for severely disabled policyholders, mandatory for citizens and permanent residents born in or after 1980s. CareShield Life also allows individuals with severe disability to withdraw up to about $1,752 per year from their Medisave account for long-term care needs. Additionally, the Ministry of Health introduced Elder Fund in 2020, providing discretionary assistance up to $183 per month for severely disabled and needy citizens. The ministry and public hospital are working together to drive value-driving outcomes through inter and intra-hospital benchmarking, minimizing unnecessary variations and encouraging best practices. Payment bundling and pay-for-performance framework have also been implemented to facilitate care transformation, reward efficiency, and prioritize key priorities like reducing hospital-acquired infections and managing length of stay.
Thank you, Juliana. We will now discuss improvement opportunities in the Singapore health system. Let's discuss the challenges through the lenses of cost, quality, access, and equity. When it comes to cost, Singapore has been facing rising costs driven by an aging population and an increasing chronic disease burden. 25% of the population will be over 65 by 2030. In terms of quality, there has been a strain on the primary care system. 80% of primary care is provided by general practitioners who don't have the same capability to handle complex needs as the government-run polyclinics. There are also issues with fragmentation between primary care and specialty care. In terms of access, the need is to increase access for those patients with chronic diseases and to scale up preventive care. And as for equity, although not as pronounced as most other countries, there still exists two tiers in the provision of healthcare in Singapore. There is a public health system in particular which is under stress for acute care services. Let's apply a population health model as a solution. This model proposed by Buck et al. Not only describes the 4 pillars of population health, but also their interconnectedness, the wider determinants of health, our health behaviors and lifestyles, the places and communities we live in and with, as well as an integrated health and care system. Now let's take a look at what redesigning healthcare delivery using a population health framework would look like. In terms of cost, the key improvement strategy is prevention and early identification of health conditions by expanding preventive services. As for quality, there are 2 key strategies. The first is health IT for data analytics to allow harnessing big data for understanding performance and gaps in care and utilizing AI for clinical decision support. The second is reducing fragmentation, integrating the different elements of healthcare into an interconnected whole. As for access, increasing capacity through expansion of both physical spaces, such as for polyclinics, and the virtual footprint, such as for televisits and hospital at home, is a key strategy, along with supporting the addition of primary care physicians, allied health professionals, and other healthcare professionals. As for equity, it is improving health literacy and social determinants of health, in addition to enhancing public system capacity, applying population health principles for the provision of care and reimbursement of services. When it comes to new products and services, Singapore is among the best in the world for healthcare innovation, care transformation, and market entry. There are many factors promoting the introduction of new products and services in Singapore. These include dependable and forward-thinking governance, a pro-business environment with pro-business policies, efficiency and timeliness for patents, strong intellectual property protection, the presence of world-renowned academia and research, a skilled healthcare workforce, a robust infrastructure, access to both national and global markets, and a high level of investor interest. As for constraining factors for the introduction of new products and services, there are only a few, and these include increasing cost of doing business and external market competition. Singapore has attracted leading institutions from across the world to work in Singapore and to do business in Singapore, and these include more than 50 companies in biomedical research and development, as well as some of the world's largest pharmaceutical companies. Singapore is one of the few countries in the world that exports more pharmaceuticals than it imports. Selena Plus is an exciting product example of successful market entry into Singapore's healthcare environment. It is an AI-based deep learning medical device that is highly accurate for detecting diabetes retinopathy, glaucoma, and age-related macular degeneration. It was developed over a period of 20 years and is a product of innovation within the Singapore public health system. Diabetes retinopathy is the leading cause of blindness in working-age adults in the world. Early screening reduces blindness by 47% through timely interventions. Traditional screening methods, however, have been labor and time intensive and not very successful at early detection. Selena Plus has had a transformative impact on the ease and efficiency of screening. It takes only 8.5 minutes to complete. It takes less manpower due to partial automation, and it is estimated that there will be a 20% cost savings. Improved clinical outcomes are expected with more patients screened and treated. It is now being implemented in the primary care setting as part of population health management and being integrated with specialty care services with ophthalmology. Of note, a case study on developing and commercializing Selena Plus was written and is available now on Harvard Business Publishing and the Case Center.
Thanks for taking the time to view our presentation. The following slides cover the content and references we use to support our research. We'd like to invite you to watch an additional bonus piece, an interview with a market access expert residing in Singapore. We hope you enjoy this special treat.